I'm Dr. Himal Gajjar. I'm a radiologist at SCP Radiology.
My name is Chrisoné Smit and I'm a sonographer at SCP Radiology.
A musculoskeletal ultrasound is typically requested of a joint when there has been an injury and where the x-rays don't show a fracture or a dislocation. But the referring doctor suspects a soft tissue injury, and that can be of the ligaments or the tendons around the joint. And that's where ultrasound plays a critical role to assess these soft tissue structures.
The machine that we use is called an ultrasound machine, and it uses sound or the waves of sound to penetrate the tissues of the body, and then the sound that is reflected back, which we call an echo, is then translated back to the machine, and then it makes up an image on the screen. We can see all sorts of structures with this machine, from abdomen work of organs, shoulders, any joints. We can do babies, we can look at blood flow in blood vessels.
Typically, the kind of specialist we'd work with would be an orthopedic doctor or a sports medicine physician and the EC doctor. And the structures that we'd look for are the soft tissues that are critical around a joint. A common injury is a ligamentous injury, and the ultrasound is a powerful tool to assess the ligaments. They can be normal, they can have a low grade or a mild injury, such as a sprain or a strain, or they could be torn, and we can grade the tear to see if it's a complete tear or it's a partial tear. Likewise, with tendons, we can assess the structure of the tendons. They may be degenerate, they may have a tear, or they may have inflammatory changes related to the tendon.
So when we look at any joints, for example the shoulder, we look at the muscles for any tears of the muscle, especially where the muscle comes together with the tendon. And the tendons attach the muscles to the bone, and they allow for specific movement of certain structures or limbs. And then we also look at ligaments. So ligaments attach the bones together, and we can also see those tiny little structures. For example, in the hand or in the AC joint in the shoulder, we can see the details. So when the patient has arrived for this scan, we can see it on our system, and then I go to our front reception to meet the patient. And then we walk through to the changing rooms. The patient will then be asked to change into a hospital gown. From there, we will take the patient into the ultrasound room and explain what the procedure entails and what we expect of them. The gel, we put that on the specific area, and that helps the sound to penetrate into the tissues, and we actually see a lot better. So that's why we use the gel. And then from there, if we've taken all our images, we send them through to the radiologist. If the radiologist is happy with the images that we've taken, the patient can go. And if not, the radiologist will instruct us on taking further images, or they will come in and examine the patient themselves.